are you today?
I'm pretty good. How are you?
I'm good. You ready to see some ultrasound today?
Yeah, I guess so. I mean, it's just gonna be babies and stuff, right?
Actually, ultrasound's used for all sorts of different things. So you might see some babies, but you more likely see other things today. We scan the abdomen and the pelvis and some of the structures in the neck as well as the legs. See all different sorts of things.
That's weird. So do you still put that crazy gel on there?
Yes, we have to use the gel or we wouldn't see anything. The gel acts as like a way for the sound waves to get into the body, otherwise they'd just be scattered through the air.
Weird. So how do you tell what comes up on the screen?
Well, you have to know your anatomy really well because what we see on the screen, there's different gray shades for different types of things. So fluid's black, so we can see our vessels. But what's really important is knowing our directions. So the different ways we hold our camera give us different angles, so we can get slices through the body across this way and slices across this way as well. So by knowing your anatomy, you can kind of tell where things are and what they are.
Is it hard to see what's on the screen sometimes?
Sometimes it can be difficult. Sometimes bigger patients are harder to see, or just technical things that make the pictures harder to determine.
So what's our first patient coming in for?
I believe they're coming in to check and see if they have positive DVT, which is a blood clot in the leg. So we'll see about that.
What time is she coming in?
Pretty soon. I think we'd better go see if she's there.
Sweet.
Okay, hello, Donald.
Hi.
How are you this morning?
Good. How are you?
Good.
That's good. So you're not gonna scan her belly today?
Not today. She will have a routine scan if she hasn't already. But today she's having some other problems we want to look at. So what are some of your symptoms today?
I have a big red bump on my leg and it's kind of swollen, and I was not sure. I was having back pain as well, so I wasn't sure if that was because of the pregnancy or if that was because I don't know, maybe there might be something wrong, but I just came back from a trip to China and I was on the plane for quite a long time, so I was just kind of wanted to get it checked out to make sure that there was nothing wrong.
Perfect. So we're going to look at your vessels in your legs today to see if we can find a clot.
Okay.
For this exam, you'll have to take off your pants and just cover up with the sheet, and then we'll see what we can find in there.
Alrighty.
All right. We'll be back in a few.
So what are you gonna change there on the screen?
I'm changing my camera because certain cameras are better for certain things. Because we're looking at the leg veins in this, we use a linear transducer versus a convex transducer. Just gives us a different look. Also, I'm using a higher frequency because the vessels are closer to the surface than, say, looking at a liver. I don't need to see as far into the tissue, so I can use a higher frequency because it'll give me a better picture, but less depth.
Okay, so what exactly is a transducer?
Transducer is the camera we use to see. It lets out sound waves and then it receives the sound waves and it goes through all this computer process and we end up with our image.
Cool.
Yeah.
So what one are you using today?
I'm going to use the linear transducer and it's pretty high frequency.
Okay. So what's the difference between that one and the other one?
So this one will give us a picture that's almost like a cone shape.
Okay.
Or it starts small and it spreads out. And this one will give us one that's just like a box.
Okay.
This one will see better for structures that are small and near the surface. This one's good for like an abdomen exam.
Okay, cool.
Alright, so you got all changed for us. You're all ready?
Yeah.
Alright. So, have you ever had an ultrasound before?
Yeah.
Okay, for your baby?
Yeah.
Alright, that's good. So you know a little bit about how we're going to put the gel on and we're going to scan. Because we're scanning your leg, we will have to do some stuff that has a little bit of pressure on it. So if we're really hurting you, let us know.
Okay.
Other than that, it's pretty straightforward. We're just going to scan down your leg a bit, just a bit into your calf.
Okay.
Alright, so start up pretty high for this exam. Put the gel on you. It's just wet and cold.
Slimy.
Alright, so this is the camera we're going to use today. So, I'm looking here is just at the vessels in your legs. Remember, vessels turn out black on ultrasound for us, and that makes it helpful. This test, we just kind of follow down your vessel. We compress. First, look to see if we can see any clots. If we saw a clot, it would turn out to be, you'd see more of a lighter shade in the vessel, something that looks abnormal. See your artery and your vein. So veins, remember, get squished. Do you have any questions?
So what are you going to do with the images after you're done?
So after I'm done, I'll save all my images and then I'll send them to the radiologist. I can't say exactly what I think it is, but I'll say whether there was no flow in an area, which means there's no blood. I can do that by looking at the color. So as you can see right here, there's flow in her vessels, which is a good sign. Because if it was clotted, then you wouldn't be able to see any color, or just a little color. So that's one of the things I talked to the doctor about, is if I do a full test that looks at the flow using what we call color Doppler and spectrodoppler. And I talked to the doctor about what I found in that, as well as I talked about how we compress the vessel all the way down. So if we can compress the vein, then there's a good chance there's no clot in there. So you can see how it goes from big to squish. And then we'll also just talk about whether we saw anything in it or not. And then the doctor will make the final decision on whether they think it's clotted or not.
Okay.
And they'll take the next step of action. We even take a quick look right behind the knee. Sometimes it's hard to get in there. The patient has to be placed in this position because sometimes even with the legs, even farther out depending on that, just so we can get more access to the vessels. Yes. Everything looks pretty good, but the doctor will have to make the final decision. Okay. So get you all cleaned up. I'll give you the first wipe and then you can kind of clean up. The doctor probably won't want to see anything else, so you can put your clothes back on.
Okay.
All dressed.
Thank you.
Sarah Thompson? How are you this morning?
Good. How are you?
I'm good. Gonna hop up on the bed for me.
So you're scanning for a baby now, right?
No, not according to the rec. We're checking up on some nodules. Are you having any symptoms in your thyroid?
I've been pretty good. A lot of weight gain and that kind of thing.
Yeah. Probably due to
I
pregnancy.
don't know if I can blame that on the thyroid or not.
Yeah. Alright, so for this exam, keep your head pretty flat, so I get you to take the pillows off and then to lie right down. So, just gonna change what I'm scanning on, the package I scan on, to thyroid, so it'll give me the optimal thyroid. Just gonna grab a glove. I'm just gonna put this around your neck just to keep your clothes dry.
Are you a student?
I'm here job shadowing Anna for the day.
Awesome.
It's nice to see interest. All right. So have you ever had an ultrasound before?
Yes, I've had a check before. It's just
Right.
I want to see how it's going.
All right. So I gotta put this beefy stuff on your neck.
Last time they saw some nodules, so I'm hoping that they're
Okay.
decreased.
Shrunk or
yeah. The symptoms have
if
gone
they're the
down,
same,
so.
that's. So this tissue here, it's hard to get the full thyroid on. All this tissue here, you can see kind of the thyroid gland. So an ultrasound is really important that we scan through things, not just take our pictures. It's also anything black is vessels. And we always look at ultrasound two ways, so this way I'm looking at it as transverse, but if I turn this way I get a different look at the thyroid. Do you have any questions about my scanning?
So will you do the same thing with these pictures when you're done? Give them to the doctor?
Exactly, they'll go to the doctor as well.
Last time it was really my family doctor that ended up talking to me about it rather than
Yeah,
I didn't really
so
hear much from the radiologist. I kind of thought I would, but
right. The radiologist is the one who makes the decisions, but everything goes to your family doctor or the doctor that sent you, and that's how you will hear the results. So,
Are you seeing anything on there?
I have to be careful what I say in front of the patient because we're not allowed to diagnose anything. It all looks pretty good, but I don't have a final say. If I did see anything, I'd have to freeze and take measurements and give the doctor all the material that I think will help them make their decision. But it doesn't look too bad today from what I see. We'll see what the doctor sees. It'll be about a week probably before they'll have the results. Sometimes less because everything's digitalized these days. But you're good to go.
all right, thank you.